I'd like to get Mr. White's cardiac cath done as soon as possible, yeah?
Yeah, I figured you'd want to get that out of the way. Luckily, the last patient on the elective list canceled, so we can get his cath done this afternoon. I already spoke with him about the procedure, and he signed his consent.
That's great. Maybe we'll get out of here on time for once.
Actually, I was hoping the cath would be done later on, so I could do it. But it's Wednesday, it's my academic half day.
When I was a resident, we didn't have academic half days. We didn't need to. We saw everything. And there was none of this going home at the end of a call stuff. These days you have to have a fellowship in order to get enough clinical exposure.
Don't worry, there'll be other cases.
Hey, don't worry, there'll be lots of opportunities. It's an hour till noon. Why don't you take off early? You can get some lunch before you go. Make sure you don't fall asleep during yet another PowerPoint.
Okay, great. I'll get going. I'm back tonight. I'm on call after my half day.
Okay, well, see you later then.
I'll see you tomorrow. I'm not on call tonight. Thank God. You know, I had him in cath labs last week. It was all I could do not to rip the catheter out of his hands. I know you have him in skills labs and you teach him things, but it's like you'd never seen a catheter before, let alone put one in. I don't think it'd be safe for him to catheterize a real patient.
I know what you mean. He's a nice resident. He's really nice with the nurses and patients, and he isn't any good with his hands. Everything he does is so awkward, and it takes him forever.
You know, that's an understatement. You know, I'd rather supervise the medical student here, have him put the caths in.